Good day. I was asked to perform the physical examination about abdomen. So I am Amil Giral, acting as the doctor for today, and this is my patient, Milan, acting as my patient for today. So first, I have this form just to make sure that he knows what is the purpose of this demonstration, and for legal purposes that he already signed the form. So I will ask him to sign the form so that we may know if he really understands what we're doing. So the first thing I would do is to make him in a supine position to examine his abdomen comfortably. So, sir, can you make a supine position? And then drape him. Sir, can you unbutton the shirt so that the first thing I would do is the inspection. So to inspect the patient, you must know the temperature, the general appearance first. So you must know the temperature, and it should be cold or clammy or warm, and also the skin color if there are bruises, emphysema or jaundice, and also the striae if there are some abnormalities, and the scars or whatsoever, and also the after you inspect, you need also to inspect the umbilicus to see if there are inflamed or it's like a bulge, because it suggests for ventral hernia. And also the contour of the abdomen, whether it's round, protuberant, or flat. And after, you can also see in the contour of the abdomen the peristalsis, especially on the skinny patients, and also the pulsations, especially in the gastric area. So after you inspect, for him, I think it's normal because there I can see abnormalities. After you inspect, let's proceed to the auscultation. By the way, in the physical examination of the abdomen, we have the inspection first, the auscultation, and the percussion, and the last is the palpation. So in auscultation, I will use this one, the stethoscope. So auscultation is very important because in this method, you can this will inform you the bowel motility, especially the bowel movements and the bowel sounds. Any variations of the sounds on the abdomen may suggest in the peritoneal obstruction or peritoneal inflammation. So to auscultate, I will auscultate in 4 quadrants, the 9 quadrants, the right upper quadrant, the right upper quadrant, the left upper quadrant, the gastric, in auscultation also, you can hear bruits, especially when the patient is hypertensive. Like it's like a vascular, it's like a heart murmur sound in the aorta. And also you can auscultate in the femoral artery and the iliac arteries to hear those bruits. And then after the auscultation, we have the percussion. So in percussion, just like auscultation, you should percuss all the quadrants by using hands with this one, and I will tap twice for all of the quadrants. So you must learn, when you percuss, you must learn the sounds, especially if it's I think there are 3 sounds that you can hear normally. It's the resonant, when you tap with the airfield, and also the dullness when you can tap the organ itself or the solid part, or even the feces. It sounds like dull. And the last is when the tympanitic, when it's tympanitic also, you can hear it normally. So I would like to emphasize, so I'll just start percussing right now. Percuss all the quadrants. So as you can see, when I hit an organ, I hear the dullness of the organ, especially focusing on the liver. So when you percuss on the liver, you should percuss in the starting in the nipple of the abdomen down. So, and this part, it should be the resonant. The normal is the resonant because the lung part is an airfield. So percuss it downward until you can hear the dullness. So when you hear dullness, it's the liver. So the normal of the liver, the normal size of the liver between the nipple and the umbilical part is 6 to 12 centimeters. But when it's more than, the liver is inflamed. So in the lower part, I will start in the umbilical line. So it sounds tympanitic because so when it becomes dull, it's the liver. So normally, the size of this one is the 6 to 12 centimeters. And the liver in the mid-sternal line, the normal size for this is 4 to 8 centimeters. So just like what I did, I just percuss. When it's dull, it's the liver. And also, the spleen, it's in the left lower part on the chest and in the axilla, straight to the axilla. So the sound is dullness because that's what I say, when you hit an organ, it's dull. And you can also percuss like kidneys, the umbilicus, and after percussion, the next thing you do is the palpation. So in palpation, palpate also all of the quadrants. So there are 2 kinds of palpation: the light palpation and the hard. So the light one is that you just palpate all the quadrants. So I would like to emphasize also, when you palpate, when the appendix, when he has an appendicitis, so the Robson sign, when you palpate it directly to the right lower quadrant, it's like his reaction. So it's sudden pain. So that's why he reacts. So that's good example of the importance of palpation. And when you palpate on the liver, you must put your left hand under his abdomen, and then just elevate your hand lightly so you can palpate the liver. So you should know if the liver is inflamed or not. And then in palpating the spleen, you can also palpate in the left, it's the line, the axillary line, and the 6th rib. So it's at the left part. It's over this one. The light palpation. And when you palpate, the importance of the palpation is to see if the abdomen has the tenderness or the muscle resistance, especially abnormalities, you can use palpation as well. So I already discussed about type palpation, so I'm gonna proceed with deep palpation. Deep palpation, I'm gonna use two hands. First, I put the left one, it's actually all of the quadrant as well, and I will palpate deeply. The right lower quadrant, the appendix, and also the umbilical and the bladder. So if there are any abnormalities that you can palpate, for example the tenderness or any organ, so it should be reported. And as of him, I can't see any abnormalities, so he's normal. So sir, and sir, I've already checked your abdomen and I can see any abnormalities. It's normal. I inspect it and auscultate and percuss it and palpate it. So that's a good one, sir. That's a good result.